we are looking at the Fondaparinux. To begin with questions, the first question is what is the bioavailability of the Fondaparinux, as well as a comment on the monitoring aspect. So in this video, we'll find the answers to this question and learn in detail. So to begin with, firstly, what is the structure of the Fondaparinux? So it is nothing but a synthetic. It is a synthetic pentasaccharide. It is a synthetic pentasaccharide. So the next question, the next point is what about the factor 10A? 10A inhibition. So the factor 10A inhibition, the answer is yes. And what about the factor 2A inhibition? The 2A inhibition. So in case of 2A inhibition, the answer is no. That is, the polysaccharide has no action on the factor of 2A. So whereas in case of the other LMWH and the unfractionated heparin, it was yes, here it is no. Then what about the bioavailability? So in terms of the bioavailability, the oral, as you know, it is not absorbed. It is not absorbed. And then we have the subcutaneous. In terms of the subcutaneous, it is very good. It is very good. Then what about the variable response? What about the variable response? So if you look at the variable response, so the variable response, the answer is no. And what about the metabolism? The metabolism, it is nothing but it is cleared by the kidneys. So it is cleared by the kidney. And then looking at the safety in renal diseases. So in terms of renal diseases, we need to know that it is contraindicated in the renal failure. So in terms of renal failure, you don't use the Fondaparinux. This is very important. And then what about monitoring? So in case of monitoring, it is not required. It is not required. Then what about the protamine sulfate as antidote? So the protamine sulfate as the antidote. So if you look at the protamine sulfate as antidote, there is no reversal. There is no reversal. Then when you look at the risk of heparin-induced thrombocytopenia. Heparin-induced thrombocytopenia. So here the answer is it is the least. And then when you look at the risk of osteoporosis. The risk of osteoporosis is nothing but it is lower. Now we move on to answering our questions. The first question we asked was comment on the bioavailability. So bioavailability in case of the oral, it is not absorbed. It is not absorbed. And the next question is what about in case of subcutaneous? Subcutaneous, it is very good. Very good in case of subcutaneous. Then we are going to ask about the monitoring. So the next we ask is about monitoring, whether monitoring is required or not. The answer here it is not required. Monitoring is not required. So this was about the Fondaparinux. To grow daily, please do subscribe.